Heart attacks happen suddenly and unexpectedly, and 1 in 3 is fatal. One key cause is arteriosclerosis, or clogged blood vessels. Medical professionals from around the world have come to Innsbruck to share their knowledge on atherosclerosis, the calcification of blood vessels that can cause serious cardiovascular diseases. They continue to focus on cholesterol, a blood fat that can be harmful in excessive concentrations. Besides unhealthy lifestyles, elevated cholesterol values can also be passed on genetically. This is currently being studied by scientists at the Medical University of Innsbruck.
Wenn jemand entweder genetisch bedingt oder nicht genetisch bedingt erhöhte LDL-Cholesterinwerte hat, dann ist sein Risiko, etwas später im Alter einen Herzinfarkt oder einen Schlaganfall zu bekommen, wesentlich höher, als wenn man das nicht hat. Und eines der Hauptaufgaben nicht nur dieses Institutes, sondern auch im Rahmen eines österreichweiten Vorsorgeprogrammes ist es, die genetisch bedingten Erhöhungen, die eben in etwa 30.000 Patienten bzw. Betroffene haben, zu finden, zu eruieren, in einem Register zu erfassen und die dann auch einer möglichen Behandlung zukommen zu lassen.
Hans Dieplinger is president of the 84th Congress of the European Atherosclerosis Society, currently underway in Innsbruck. Over 2,200 scientists from around the world have come together to share their latest findings. This includes recent results on lipoprotein A, LPA, by researchers from Innsbruck. Like cholesterol, this blood fat can also cause blood vessels to clog.
Lipoprotein A ist ein weiteres Blutfett, was man in der üblichen Vorsorgeuntersuchung zum Beispiel nicht mitmisst. Es kommt ihm aber eine besondere Bedeutung zu, weil hohe Konzentrationen mit einem erhöhten Risiko für Herz-Kreislauf-Erkrankungen verbunden sind. Das sind zum Beispiel Herzinfarkte oder Schlaganfälle. Es haben ca. 20% der Bevölkerung haben erhöhte LP-A-Konzentrationen und die 10% der Leute mit den höchsten Werten haben eine Verdoppelung des Risikos für einen Herzinfarkt. Also es kommt ihm dadurch eine besonders wichtige Rolle auch zu, wenn es darum geht, das Risiko für Herz-Kreislauf-Erkrankungen abzuschätzen.
LPA has been the subject of research in Innsbruck for 30 years. Scientists have yet to ascertain its purpose in the body. Elevated blood fat values, whether cholesterol or lipoprotein A, are a ticking time bomb. One of the best-known speakers at the Atherosclerosis Congress in Innsbruck is Michael Brown. His discoveries on the regulation of cholesterol metabolism earned him a Nobel Prize in 1985.
I think it's very important. You know, when you have a disease and there's no treatment for it, then people don't much care about the diagnosis because there's nothing you can do about it. But what's happened now is that we have medicines that are very effective for treating FH. And so it is important to diagnose it, and especially to diagnose it early so that you can lower the LDL level early in life. You know, there was no awareness of it, and there's no society. You know, everybody knows about lung cancer, you know, and smoking, but really very few people know about FH, and that's why societies have been formed both in the US and in Europe to try to correct that.
There has been a lot of research on unhealthy blood fats in the past 30 years. Among other things, the Congress in Innsbruck is also being used to launch a new generation of medication. New diagnostic and therapeutic guidelines are also being presented. The goal is to further reduce the risk of heart attacks and strokes.